Hello friends, this is Physiotherapy from HealthQ Rehab. Today I am going to guide you about what you should do in acute, in a recurrent and in a non-symptomatic stage of the dizziness. If you are in a recurrent phase, make sure to note down your triggers. As mentioned, food intake can be one of the major causes and a trigger factor behind your recurrent output of a dizziness. Caffeine, more of visual stimulation, over or underdoing of the exercises, behavior and some other body positions which leads to aggravation in dizziness, or any of the rushing activities should be modified in your daily lifestyle. Now, what are the management towards the recurrent phase in dizziness? The first and foremost, you must aware about what are the dizziness and when the dizziness causes and it gets relieved. The first point, you should make yourself aligned towards the non-dizziness or the body positions which can be altered towards subsiding of the dizziness. Next, you should take your medications which enhances the suppression of dizziness. In the management of the recurrent phase of the dizziness, the first point you should make aware about when and what are the body positions and the behavior which causes the dizziness. This should be modified and this should be relieved as per the medications or as per the manuals which has been prescribed. If you are the patient of B.P., make sure to learn the self-maneuver techniques to reduce the vertigo or the dizziness episodes. Furthermore, try to incorporate in your daily activities such maneuvers to reduce its symptoms. To visit and progressive rehabilitation must be progressed in the patients with a B.P. Next, you must take and carry your medications of the dizziness suppressants. Next, there should be and fall cautions in your residential and in your workplace, which includes modifications and the lights, frames and supports as per your need. Next, you must align yourself and make your body position in such a way that the dizziness gets suppressed with the aligning yourself towards the gravity. Make sure to reduce all such symptoms and the triggers into your life and make it in a daily lifestyle habit. The symptoms, if persist longer than that, make sure to manage your dizziness with the consulting towards a doctor. In the management of anxiety and depression, make yourself to give a structure to your routine. Do and the habituated strategies learning program from vestibular rehabilitation by your specialized physiotherapist. Sufficiently take an enough amount of rest to rehydrate and make yourself to come back to zero again to the next routine. Next, make yourself to a day where you give an extra effort to treat yourself. Embrace with your support system and give some time to your nature. Make sure to rehydrate and give an electrolytic balance to your body. In the non-symptomatic dizziness, the first management you should make sure is to assess your body on self. Track and progressive report on your trigger points and the risk factors associated with it. In the symptomatic management of the dizziness, the first and foremost thing is to be done is to make yourself a progressive report of the tracking of your own symptoms. Track about what are the risk factors, what are the associated body positions in which the dizziness gets aggravated. Make sure to enhance the progressive rehabilitation in the exercise plan. The exercise plan must be covering with a few points and the strategies like gaze stabilization exercises, VOR cancellation exercises, some of the strategies to embrace the habituation and the adaptation techniques in your vestibular rehabilitation. Balance training also helps the person to regain its own quality of life and make themselves independent again towards the routine. I hope this video finds you helpful towards managing your dizziness in the different stages of life. Make sure to share the same video with your family, friends and to the person whom you are knowing who is suffering from dizziness. To give a like, share and subscribe to our YouTube channel. Thank you.